Hello guys, I hope you're well. So today we're going through migraines. So what exactly is a migraine? Migraine in a basic angle is a headache. So it's a common primary headache disorder. So generally I would just define it as a form of a headache. Forget the primary disorder, that's just too much and they're trying to make it difficult. So migraine is a headache and it's categorized by photophobia. So essentially you'll become more sensitive to light. Nausea, vomiting, phonophobia, which is sound, so auditory issues, or you're sensitive to noise. That's why when people have migraines from period pain or periods or menstruation, they generally want to be in a room alone without any noise, without any light. That's the first point. Headache is typically unilateral, so one-sided, pulsating or throbbing, and lasts 4 to 72 hours, so 4 hours to 3 days. Migraine symptoms are often aggravated by or cause avoidance of routine activities or daily life, such as walking. And they can occur with or without aura. That's a very crucial point to understand. So migraines can happen with or without aura, and that's crucial. An aura is characterized by transient focal neurological symptoms, for example, visual symptoms such as fortification spectra and or scotoma. So in an exam, I wouldn't worry about these words and stuff like that. Just remember, first point is migraine is a headache. You can have vomiting, nausea, photophobia of it. And remember that it lasts 4 hours to 3 days. And you can have aura with or without aura, that's basically it. Depending on the frequency of attacks, migraine can be classified as episodic or chronic. Episodic migraine occurs on fewer than 15 days per month. And chronic migraine is headache occurring on at least 15 days per month. Migraine is thought to affect about 1 in 7 people globally. It is 2 to 3 times more common in women than men. So women tend to get migraines mainly from periods, so menstruation, the menstrual cycle. So the best analysis I can say is a migraine is like epilepsy, because epilepsy can be triggered by a lot of things. Epileptic seizures can be triggered by food, chemicals, a lot of different things. And migraines are the same way. So migraines can be triggered by a lot of external factors, and that's very, very important to understand for the exam. So acute migraine management can be done by trigger avoidance. However, you can only do that if you know what trigger to avoid, because what is triggering a migraine, for example. Drug treatment of simple analgesia such as paracetamol, ibuprofen, or aspirin, or triptans. An antiemetic, prochlorperazine or metoclopramide may be added even in the absence of nausea and vomiting. So preventative treatments such as propranolol or topiramate may be considered in adults who are not pregnant or breastfeeding as well. And yeah, that's quite important. So the referral is needed if your migraine is lasting more than 3 days. And that's very important to understand. So if your migraine is going to be long-term for this one would be more than 72 hours, so 3 days, then that's when a referral might be necessary. So yeah, that's very crucial. Episodic migraine occurs on fewer than 15 days per month, and a chronic migraine is headache occurring on at least 15 days per month, so keep that in mind. So just to recap quickly, migraine is a common headache disorder. You can have photophobia, nausea and vomiting. It's one-sided, unilateral, similar to bacterial conjunctivitis, which is unilateral as well. It's pulsating or throbbing, and it lasts for 4 hours to 3 days. And it can be aggravated by other factors externally around the environment. And migraine can occur with or without aura, and aura is characterized by transient focal neurological symptoms. In other words, it's just aura is characterized as symptoms that are purely mental. That's basically it. And you can have episodic or chronic, and episodic migraine occurs fewer than 15 days per month, so fewer than half a month. And the chronic migraine happens for at least 15 days per month. And that's very crucial. And you need to avoid the triggers, but you can only do that if you know what's triggering the migraine. If you don't know what's triggering the migraine, then yes, you cannot avoid a migraine. Simple as that. So you can give antiemetics such as prochlorperazine or metoclopramide in even the absence of nausea and vomiting, as they are antiemetics. Antiemetics meaning they they stop vomiting. Emesis is vomiting. And yeah, that's the main points on this website right now. And a migraine lasting more than 3 days is basically a uncontrolled migraine, basically. And drug treatment with simple analgesia such as paracetamol, ibuprofen, or aspirin, or triptan. And you can give triptans with paracetamol or an NSAID, and these can be used to manage acute migraines. And as we've said, migraines can last for 4 to 72 hours. And I think that's the main point to take away from here. So it's unilateral, it's pulsating and throbbing, and it lasts for 4 to 72 hours. That's the main points that they're asked about in the exam. Knowing that it's common is irrelevant because we know that. And knowing that it's due photophobia and phonophobia is quite important. So photophobia, phonophobia, 4 to 72 hours, unilateral pulsating throbbing, with or without aura. Chronic migraine is at least 15 days per month, and episodic is less than 15 days per month. And yeah, referral is needed for migraines lasting more than 3 days, and that's another important point as well. Thank you so much.